Hello and welcome. I'm Nick from Metropolitan Group, a communication social change agency. We have been working with Oregon School-Based Health Alliance over the past few months to create a campaign to help school-based health centers effectively promote COVID-19 resources and healthcare services. We're here today to provide a little bit of background information about how this campaign was created. And then we will walk through a toolkit that is filled with easy-to-use, customizable materials to share information about your SBHC. When we started this project, we wanted to make sure we heard from SBHCs what materials and messaging would be most helpful. We shared a survey with SBHCs from across Oregon to get input, and we also had one-on-one discussions with the selection of SBHCs, students, medical service providers, and parents. We learned what barriers and misconceptions exist around general health services offered at SBHCs, as well as barriers and misconceptions about COVID-19 vaccinations and resources. This background research allowed us to create messaging and materials that would really resonate with students, parents, school staff members, and community members. We also took into account that every school is different in terms of the students they serve, staff capacity, resources, and preferred communication channels. The materials were developed with a recognition of the spectrum of capacity for communication from one health center to another. It was also important to create customizable materials so that each health center can tailor them to their own regional and cultural context, as well as designate which services are highlighted. We also created separate messaging for students and parents. The look and feel of the design is intended to be relevant to the audience of school-aged, especially high school students. This was achieved by drawing inspiration from popular forms of media for this group, such as manga and comic books, animated YouTube videos, and social media graphics. It was important that students could see themselves in the communications through the illustrations, so a range of diversity was intentionally created to represent teens throughout the state of Oregon. Since these materials need to be customizable and printable by centers throughout the state, a simple design is used, avoiding backgrounds or large amounts of color. The fonts are accessible to the centers needing to customize the materials, and tools such as QR codes are used so that the intended audience is able to find more information as needed. So let's walk through the toolkit together. We've included some tips and best practices for using the toolkit to customize materials that resonate with your community. This includes customizing materials and making sure to layer in local context or knowledge so they resonate with your community. On many of the materials, you will see we have also included a space for you to add a QR code to the materials. QR code is short for Quick Response Code. You can visit this code generator website, add the website URL to your SBHC or school, and a general code in seconds. The materials provided in the toolkit include flyers, posters, social media graphics, and copy, a brief guide to using social media, language to add to a website, newsletter copy, and all of the graphics so you can use them however you desire. All of our materials are provided in 7 languages: English, Spanish, Hmong, Vietnamese, Russian, Simplified Chinese, and Chuukese. These were the languages most requested by SBHCs. Let's start with the flyers. We have 2 flyers that were designed to reach students, which can be hung up around the school or passed out at events. And we have a flyer designed to reach parents or caregivers, which can also be handed out at events, at the school, or in the community, or given to students as a backpack stuffer. Select the language you would like and it will take you to the material on Google Drive. Click on File, Download, and then Microsoft PowerPoint. Open it up and you will see where you can add customization. For example, on the flyer you can add your school name, logo, QR code, and the hours and phone number for the health center. If there are things you don't have or want to add, like a logo, you can just delete it. The process for downloading the posters is the same. It is important to note that we created tear-off tabs on the posters with a customizable QR code if you would like to add it, so that students have an option to discreetly take information with them if they prefer. Posters are 11 inches by 17 inches and make sure to cut along the dotted line so that the tabs can easily be torn off. For social media, we've included a brief social media 101 guide that shares some best practices and information on how to put together a content calendar. We've also provided some graphics and copy to use on Facebook and Instagram. From our research, we learned these were the two most important social media platforms. Of course, if you use other platforms like Twitter, you can use or tweak this content. After you download the social media graphic, make sure to export it as a PNG or JPEG so it is easy to upload to your social platform. You can do this by clicking File, Download, and then saving it to your computer. Suggested content to post with your graphic is also available in each of the languages. You'll find copy to add to a website. If you don't have a website or page for your SBHC, ask your school if they will add a page to the school's site that includes the provided language. We have included newsletter copy as well. Ask your school if they would consider including this in communications sent out to students and parents. We've provided all of the graphics here so you can swap them out or use them on other materials. When thinking about how to get the word out about your SBHC, consider running an ad on your local radio station. Here, you'll find a few different options in English and Spanish. Youth Advisory Councils, or YACs, can also help promote the SBHC to their peers and community members. If you have a YAC, share this toolkit with them and ask what kind of outreach they can help with. The graphics were designed to be able to print in color or black and white and work best printing from a laser printer. We know not everyone has access to a color printer. You can also upload files online to FedEx Printing or visit your local print shop. Thank you so much for watching this video. We hope you find these tools and materials helpful.